All right, next muscle.
Superficial gluteal.
Superficial gluteal. Now, be careful, because when I point this out, if I point, I'm not going to do this because that points nowhere. That's in between two of them. The superficial is the one towards the caudal. It looks like it's made of two bellies. It's the superficial gluteal. There, I've raised it up. See it? Okay, superficial gluteal. What is its action? Extends the hip. When this contracts, it extends the hip. Next one.
Middle gluteus.
Middle gluteus is underneath it to the anterior cranial in an animal. Cranial here, it also extends the hip. The next one.
Deep gluteus.
Deep gluteal. If I take the tensor fasciae lata and the middle gluteal and separate them, and I look down and I say, this will be on the test, see that white tendon? That's the tendon of a muscle that lies deep to these two muscles. That's the deep gluteal. Deep gluteal, okay? So you'll know that. What's its action? Extends the hip joint, okay? All right, next muscle. Okay, that one is a V-shaped, upside down V-shaped muscle, and tensor fascia, which means it tenses the fascia, which is the fascia lata. Okay, so tensor tenses the fascia lata.
Will you be using the dog for the glute?
You want me to use the dog, don't you?
Yes.
Okay. All right, tensor fascia lata. All right. And what's its action?
Muscle flexes, yeah.
Say again?
Muscle flexes the hip and extends.
Flexes the hip and extends the stifle. When this contracts, it pulls the stifle out. Next.
Cranial anterior sartorius.
Okay, that needs to be. Okay, there's two bellies of the sartorius. Now be careful because your cats only have one. Okay, your cats have one belly. This is two. The cranial sartorius, the caudal sartorius. The cranial sartorius does what? Extends the stifle. The caudal one flexes the hip. Okay, it can also flex the stifle somewhat. Cranial one's in front.
Okay.
Cranial and anterior are the same. Yeah. When you talk to your dad about this, okay, he uses anterior, posterior. He doesn't use cranial and caudal very often. But in animals, we use cranial and caudal. Okay, next muscle.
Semitendinosus.
Semitendinosus. If you see me do this, okay, and then I say the muscle next to this one, which is the biceps femoris, the long one, is the semitendinosus. What is its action?
It extends the hip by increasing the angle between the pelvis and the femur.
Extends the hip. This is going to be a matching part as far as you'll get this without the actual muscle names, and it'll have a letter or number in front of it, okay? All right, next one.
Semimembranosus.
Here. Peeking out, the triangle that peeks out. If I remove this muscle, you can see it's really a big muscle. Semimembranosus. Okay? All right, it should have very similar action to the semitendinosus. Next one.
Rectus femoris.
Rectus femoris in the front. Now this one is cut. Take a look. It's the cylindrical one right in the front. Okay? Rectus femoris. It's part of the quadriceps group. Next.
Vastus lateralis.
Lateralis. Okay. Medialis. In between, down next to the bone, is the intermedius. Vastus lateralis extends the stifle. Vastus medialis extends the stifle. Vastus intermedius extends the stifle. The rectus femoris does not. What does it do?
Flexes the hip.
It flexes the hip. Okay? That's the one that pops on you for you soccer players. That's the one that pops on you when you're practicing at the beginning of the year, and it hurts. It hurts a lot, and you'll see it pop up. Okay, the other one you'll see pop up is what I'm going to get to in a minute. Next one.
Gracilis.
That's the big one on the inside. Big, it's kind of thick. Okay. All right. Gracilis, it adducts the leg. Next one.
Adductor.
It adducts the leg. That's underneath it and in front. The next one,
Pectineus.
pectineus is in front. What are the items in this area right here? It's in the shape of a triangle.
Oh, it's the
The femoral
Femoral
triangle.
artery,
Yeah.
femoral vein, and some of the large nerves. Okay, next muscle. Okay, now we're on most of the muscles that you will get on the cruce, which is the distal limb, are going to be seen from the lateral side. Be careful, right here is this one here, okay, is the cranial tibial. You can look as you're practicing. Follow the tendons backwards. Cranial tibial. This one is my mistake. This one is actually kind of one muscle. It's the long digital extensor. Okay? What does it do?
extends the digits.
Ta-da!
And flex
Okay.
the tarsus.
Okay, the next one,
Peroneus.
peroneus longus. Okay, what's its action? That's an odd one. What's it do?
Plantar.
Flexes the dig-
It
says-
plantar flexes the digits, which means it comes down here and it causes you to be able to do this with your toes.
Oh, okay.
Okay, all right. And the next one is a very tiny one. See that one? That's the lateral digital flexor. No, extensor.
Extensor.
Yes. And it extends. Change that. It only extends digit 5. It only I said 4 and 5. That was wrong. Okay, the next one.
Deep digital flexor.
I'm going to, right next to the bone is the deep digital flexor, big bellies, deep digital. And then these here,
Gastrocnemius.
2 of them. What are the 2 major muscles that form the Achilles tendon?
Popliteus and gastro.
No, not the popliteus.
Superficial
Superficial
flexor.
digital, that's wrong too. It says superficial flexor, should be superficial digital flexor.
Okay.
Superficial digital flexor.
And gastrocnemius.
And gastrocnemius.
Which one's the superficial digital?
The one in front, anterior to it. See it here? That's
Yeah.
the superficial digital. This is the gastroc bellies.
Okay.
And then the last one is, you'll see me do this. You'll see me do this, and then I'll say, what is this little muscle that is at an angle?
Okay.
That's the popliteus.
Okay.
That's what I always check for lymphoma. When I have an animal come in and it's doing poorly, and you'll see a veterinarian and a human. Watch your physician. He'll do this. He checks your lymph nodes. He checks other places. He'll have you sit, take your shoes off. He'll run a